We're here at the Business to Business Forum on healthcare to discuss the really important issues to the business community about healthcare. There have been, for the last 30 years or more, really 4 issues that have been concerning us in healthcare and remain a concern for the business community, and those are access, cost, quality, and experience. And probably for the business community, the most pressing issue right now is the cost of healthcare, which just continues to accelerate. And it's a problem because we're not getting the quality and the experience that we should be for the amount of money we're spending.
Okay, so why is it important for the business community to be engaged in this dialogue?
So for businesses, the cost of healthcare, assuming they provide benefits, which most do, the cost of healthcare is the second largest cost they have of running their business after paying their employees. So, and it's frequently a cost that they don't directly control, and it's a cost that they find somewhat unpredictable. So we're here to help them understand the drivers of cost and, more importantly, some of the solutions that are being introduced around cost and improving quality and experience and value.
Okay, so what are some of those challenges and opportunities that you're presenting to businesses today?
So we want to have a dialogue with the business community around, for example, what's causing the rise in drug costs and how those can be moderated, how they can use wellness programs with their employees to help change lifestyles and other things, which are a big driver of people's healthcare conditions and ultimately costs. And then also talk about some innovation. I think Einstein defined insanity as doing the same thing over and over again, expecting different results. So we need innovation in healthcare to really fundamentally change the way care is delivered between a doctor and a patient. So technologies that allow us to deliver care remotely, the use of data and analytics to predict healthcare events and then intervene so that we're keeping people healthy and they're not decompensating and going into the hospital.
This is a great day. I mean, this is an opportunity for small businesses to become more informed about the healthcare market, what it is and what it will be.
And so why is that important in a greater context?
We just did a survey. 9 out of 10 of our members, this is their number one issue. It's about the premiums, it's about the uncertainty of the future, it's things they can't control. So it's an opportunity for people to become more informed and to ask their questions.
So what do you want people to remember today?
Well, my dream for them is they're going to be able to make informed decisions, both for their business and for their employees.
I want to welcome everybody here to today's Business to Business Forum on Healthcare Solutions. I'm Steve Udvar-Hai, the President and CEO of Blue Cross and Blue Shield of Louisiana. And since 2 data points make a trend, this is the 2nd annual Business to Business Forum, and we're once again pleased to partner with others in bringing you this event, specifically GNO Inc. and the New Orleans Chamber. As many of you know, this is, as was true last year, an important time in the ongoing dialogue and debate about healthcare in our country. And while my crystal ball is not perfect, as we go into the midterm election year next year, I don't see the debate on health care going away. So that's a preview of maybe there'll be a 3rd annual event next year, depending on the feedback we get from today. In addition to thanking our co-sponsors, I do want to thank in advance our keynote speaker today, who will be joining us at lunch, Dr. Richard Milani of the Ochsner Health System, who will share with us his thoughts on innovation and improving health outcomes, which I think you will find enjoyable. I also want to recognize our panel members at lunchtime, Dr. Corey Hebert from Tulane, Dr. Vindell Washington of Blue Cross, and our moderator, Mike Berto. That should be an interesting conversation as well. And then finally, we have a number of breakout sessions today, and I want to thank the individuals who will be leading those both later this morning and this afternoon. So what I'd like to do in a few minutes now, before asking my 2 co-sponsors to say a few words as well, is really just set the stage for the dialogue today in the context of healthcare and its importance for the business community. I think first and foremost, we realize that rising healthcare costs and the need to improve quality and healthcare experience continue to be a challenge for all of us. It's a challenge for employers, it's a challenge for providers, and it's a challenge for individuals, whether they be purchasers or patients. And it's true in New Orleans, it's true in the rest of Louisiana, and unfortunately it's true across the country. I've been in this business for almost 30 years, and the same four problems that were front and center 30 years ago are front and center today. And they are simply access, cost, quality, and experience. So the reality is, despite having what the world would say is some of the best doctors, best hospitals, medical device companies, pharmaceutical firms, and health IT companies in the world, and we're trying to attract, I know, many of those businesses here to New Orleans, the system overall is broken because we're not solving those four issues in an effective way. The Affordable Care Act, we'll start with access. The Affordable Care Act was supposed to expand access, and to some degree it did that, although that's sort of in jeopardy and in limbo now with the debate going on in Washington. Reality is that today we still have 30 million people in America who don't have insurance. And I would say we don't talk a lot about this, and this will bridge to my next comment on cost, but for everybody else who has insurance, I think we still have a problem of underinsurance, because the cost of health care, even for people with insurance, is a barrier to them seeking and getting care. There's a lot of instability in the individual market, and the future of funding for Medicaid will be front and center of the federal funding debate. So let's talk now about cost. The Kaiser Family Foundation, which tracks this, said in 2016 the average cost for employer-sponsored contributions, this is the employer-sponsored contributions, was about a little over $18,000 a year. Now, to put this also in context of individuals, when the Affordable Care Act came out, 2014, and you were fortunate enough economically to be above 400% of the federal poverty level for a family of four, which was just about $100,000 a year in combined family income, then you would have had to have paid 30% of your gross income to buy a health insurance policy. Today, premiums in the individual market, for a variety of reasons, have risen by almost double in some cases. So it's becoming, even for people who have access to insurance, it's becoming unaffordable. And in the employer-sponsored market, at $18,000 is about a 60% rise for employers over 10 years. In that same period, employees have gone an increase of about 80 to 100%. So for employees, the cost of health care, even when they're getting employer-sponsored coverage, has also doubled over the last decade. And there's a lot of reasons for that. There are a lot of good reasons in that we can treat people in new and better ways than we were able to do a decade or so ago, but at a cost that's rising at an alarming rate. And I would just single out pharmaceutical costs because of some news that some of you may have seen, last year. I mean, today for pharmaceuticals, we spend more in our healthcare system for pharmaceuticals than we do for physicians. And to highlight that cost of rising drug costs, I won't mention the firm by name, but a well-known pharmaceutical company released a new leukemia drug last year at the bargain price of $475,000 per single treatment. So that's the cost of the new drugs coming out, where we say in a personalized medicine, genomic tailored way, that's the price tag coming out of the new drugs there. So those costs are impacting all of you in the room. Those costs drive up the cost of healthcare. Cost of healthcare goes up, cost of insurance goes up. And why is that an issue for businesses? Because health insurance is typically your second largest cost of doing business after you pay your employees. And we're competing in a global economy. with countries that candidly spend far less than the United States per capita. We spend more per capita than any other developed country in the world, almost 18% of our gross domestic product. Most other countries are down around about 10%, so we're not quite about 2 times. And for that, we have the good fortune of ranking 34th in the world at life expectancy at birth. So I don't know about you, but I would say I don't know that we're getting what we're paying for in that equation. And the variation in cost is not just an international phenomenon. Costs vary across the United States. You guys may not know this, but we have a unique distinction in Louisiana, not favorable. In 2013, the Institute of Medicine published a study based on Medicare costs, but it's probably not that different for commercial. They rank ordered areas in the United States according to cost per capita, and of the 400 and plus large areas that they ranked, 6 of the 10 most expensive areas in the United States were in Louisiana: Metairie, Baton Rouge, Lafayette, Monroe, Alexandria, and Shreveport. So it's not south, it's not north, it's not the middle, it's all the above. And at that time, we ranked 49th in the country in terms of quality measures and outcomes. So we are a microcosm of the U.S. problem of spending a lot, but not necessarily getting the benefits we feel that we should. And I'll just end with this. So, you know, we're on the top of the bad lists and the bottom of the good lists. And I don't know that there's a list for healthcare experience, but for those of you who have been patients and or taken care of a family member who's been a patient, I would just ask you to do some introspection and ask, how easy was it to deal with the healthcare system broadly defined? And by that I don't mean the doctors and the hospitals, but the doctors and the hospitals and the pharmacists and the insurance companies, et cetera. I've been in the business for 30 years. It's not easy for me when I try to navigate the healthcare system. I kind of thought I figured it out before I moved here, but even after a year and a half here, it's hard for me to figure out how to move around the healthcare system in Louisiana. So the experience compared to other things we do in our life is complicated and not easy, and I think is ripe for innovation and other things to help transform that. The good news, in my opinion, is the American public will eventually put pressure on those of us in the healthcare system to fix this, because they're going to take their experiences everywhere else in life, and our kids are going to do it, right? Our kids that live on this device are going to say, I expect healthcare to meet me here. And if we in this room don't do it, by the way, I'm sure Jeff Bezos at Amazon has a plan. All right? I mean, I'm sure that people weren't, I'm sure that, you know, Albertsons and other people weren't expecting him to buy Whole Foods, and I think they're probably a little bit worried about what that means. So I think I'll leave with this. So the message is that these issues are complex enough, durable enough, that we really need to find a different way to work together to solve them. So hopefully here's what you're going to hear today. You're going to get ideas about how we're doing this. You're going to hear about insurers and providers collaborating in new ways, putting that patient member at the center. You're going to hear about how we're using data in new and innovative ways to predict healthcare events, not just look in the rearview mirror, and by using that prediction to give that information to doctors and patients to get them to change what's going to happen and avert those events. You're going to hear about using technology to get care to people remotely, new strategies for managing those rising drug costs, and lastly, ways that wellness programs can keep employees healthy. So it's not all doom and gloom. There is light at the end of the tunnel, even though it's been a 30-year journey with the same 4 problems. And also, you're going to hear, I know particularly from Michael, about how healthcare is not only impacting businesses, it's a big part not just of the country's economy, but it's a big part of the regional economy. So we need to balance the way to take advantage of regional economy, helping that build our economy, with not adding to this cost problem that we already have. So with that, I'll end my remarks, and now I'd like to turn it over to Ben Johnson from the Chamber of Commerce for a few comments as well. Thanks, Ben.
Well, good morning. The New Orleans Chamber is a proud partner with Blue Cross Blue Shield and with GNO Inc. We think today is a very timely session. In the chamber world, we hear all the time from the employers and the employees how important healthcare is and how unpredictable it is. So what we were excited about in this partnership, it's allowing us to become more informed with a very timely topic that's impacting everybody in this room. The New Orleans Chamber just finished a survey among our members, and the question on healthcare was, what is the biggest concern you have about healthcare? 8 out of 9 members said their biggest concern was the cost of healthcare. 8 out of 9 members. I mean, this is just pivotal in everybody's mind. Other related healthcare concerned issues included the uncertainty of annual increases in health premiums, the uncertainty of the healthcare market and its requirements, and the lack of transparency in healthcare costs were the top issues. So today we have the opportunity to learn from experts, to ask our questions, and to network with our colleagues. It's vital, the information I think is going to be vital for all of us, both for our business's bottom line, but then also for each one of us as we pay our part of the premium for our families and our kids, our spouse. That this has a double impact, because some businesses, the smaller they are, the more they seem like they're concerned about going out of businesses. The larger they are, they know that's just a growing portion of their budget, disproportionately growing to all the other issues they have to face. So at the Chamber, we believe that informed people make informed decisions. And we think today's forum is going to enable all of us to become much more aware. And I can only encourage all of us to stay actively involved in this ever-changing, dynamic healthcare market and take leadership roles to voice our concerns and talk about the importance of having a healthy workforce, a healthy community. So I want to thank everyone for coming. I see a lot of our members here. It's great to see you. Look forward to being with you for the day. And now I'd like to bring up Michael Heck, the President and CEO of GNO Inc., and he will offer a few words. Michael.
Great. Ben, thank you so much, and thanks to the New Orleans Chamber for being such an important partner with GNO Inc. Y'all are fantastic to work with, and Dr. Overhigh and Blue Cross Blue Shield, thank you for being such an incredible partner, not just here, but all of Southeast Louisiana, to economic development, a true place at the table, and you're always looking out for the common good, so thank you. I guess the question I had before I made a couple of remarks here is that if Amazon put out a healthcare plan, would it be the Amazon Prime of Your Life plan? Is that what it would be, or no, we don't know that yet. They don't know that yet. Too soon? I'm gonna be sorry. It's the brain and the coffee, and it's a thing. I'm going to be presenting today in the breakout sessions on the opportunity in economic in healthcare from an economic development perspective. Just a little amuse-bouche here for this. If you look at the slide up here, some of the stats that are critical to know about how important it is, as Dr. Seif said, to our economy. Already today, close to 78,000 people in just our region are employed in healthcare. The only industry that's bigger is hospitality. But then comparing it to hospitality, I want to look at a few things. The growth projected that over 13,000 new jobs over the next decade. That's a total of about 30,000 jobs when you consider turnover. So 30,000 gross jobs over the next decade. And then most importantly, look at the wealth that can be created by these jobs. People are always talking to us, and Ben, I'm sure, about the affordability and how it's getting more expensive to live in the New Orleans region. I would argue that fundamentally, New Orleans does not have an affordability problem, we have a wealth problem. I think that's really what it is about. I think it's more the numerator than the denominator. And so in healthcare, you have the opportunity. 52% of the jobs are actually middle-skilled jobs. Average salary for this is close to $16 an hour, or close to $35,000 a year. When you get into the high-skilled jobs, you get up for the average salary being $31 an hour. That's over $60,000 a year. And the average median for people that have graduate degrees is $52 an hour, or close to $110,000 annual salary. So there's really a lot there. But the real prize, and I just want to put, I don't know if you all can see this. Can anybody make out what that kind of battle star is right there? This is the real economic prize. You can't quite see it because I guess it doesn't have its landing lights on, but that is the 54 institutions anchored by MD Anderson that make up the Texas Medical Center. And I tell people that if we do a great job with our existing healthcare here, we're going to create tens of thousands of jobs for our local residents. We're going to have great healthcare outcomes for our citizens, which is critical in so many ways. But the real prize is getting going what they've got going over in Houston, which is destination healthcare. Here's the stat that I heard that I cannot get out of my mind, and that is that 25%, 1 out of every 4 people that are in Houston in a hotel are there because of the medical center. Okay, that is pure economic development when people are taking their dollars from around the country, around the world, and flying to MD Anderson or the other hospital for cancer care or other. So I would put out the thesis that that's what we have to do here. Now, we're already on our way. If you talk to Ochsner, I think there are already 90 countries that are served by Ochsner, and it's world-class care in a number of ways. But if you look and you really want to get the brand and the magnetism that you have in Houston, what do you have to do? Well, the first thing, you got to look at what assets you have. We already have great healthcare assets with Ochsner, with LCMC, with Tulane HCA, with Xavier, with many others that are around. We have the capacity there in the research and in the clinical. Then you got to go all field of dreams, all right? And so the first thing is, well, if we build it, they will come. Well, we've built it. We've got some of the most beautiful healthcare facilities in the country, I would argue, right now. If you like Terrazzo, you should go see the new LCMC. It's beautiful. Ochsner is investing, what, $600 million over on Jeff Highway, a huge amount of investment towering over the city. So we've built it. So then using the sports analogy, it was like building the dome. But was building the dome enough to get the fans to come into the seats and to get 90,000 people there? Of course, the answer is no. After that, you need the team. So you've got to spend the money to get the Drew Brees in the offensive line. And if you look at all these places, whether it was Dr. Clark back in the 40s at MD Anderson, or the doctors that were doing innovative cardiovascular work up at Cleveland Clinic, it always comes down to the doctors, the researchers, the PIs that are in there, and they are the stars. So our next task is to come up with enough money, and I've heard numbers from 50 million to 200 million, to get the very best people from around the world to come and do their research and do their clinical and practice in Louisiana. And if we do that, then we'll get the fans to come to the stadium. Then we'll get the economic development benefit that you're seeing at an MD Anderson. And it could be in a number of areas. It could be in vascular, it could be in diabetes, could be in neurodegenerative diseases like Alzheimer's. But we've got to pick those specialties and get the all-stars, and then folks will come, and that's the true economic development prize. Thank you for listening to my rant. Again, Dr. Steve, thank you for having us here today. Thank you everybody here for joining us, and we'll see you at the breakout sessions.
I think part of the problem is it's a very complicated, changing issue, healthcare. So for a small business to have the capacity to stay informed, to make the best decision both for their business and for their employees, this is a great takeaway, either to learn today or to start making more connections to stay informed.
We want the business community to be engaged, to understand that it's important for them to work with not just us as an insurer, and they may or may not be using us, but that it's really, these challenges are so complex that what we really need to do is create an environment where the business community is partnering with the healthcare community and with policymakers and others to tackle these challenging problems. Because I think the working in silos is one of the reasons why we've been addressing these 4 issues of access, cost, quality, and experience for the last number of decades with really measurable improvement. And so that's the take-home message, is that we've got to work together in a collaborative way to make a difference, because I think the system is at a breaking point.